Hi, everyone. This is Dr. Ariana Anderson. I am a naturopathic doctor at Anderson Family Chiropractic and Naturopathic Care, or as we sometimes call ourselves, AFC Wellness. We're going to talk a little bit about heart health today and how you can support your heart with a natural, more holistic approach. Bringing up a proverb, above all else, guard your heart, for everything you do flows from it. You know, that's so true. And I know that Solomon was probably talking more proverbially, if you will, since it was in the Proverbs, but it's so true. Our heart is impacted by literally everything that happens in our body. And so we really do need to support our heart, and that you absolutely can do this naturally from a holistic perspective. So atherosclerosis, atherosclerosis is the hardening of arteries caused by arterial plaque formation. Now, it's interesting. This is actually made of overgrowth of muscle cells and fibrous tissue. Triglycerides, cholesterol, calcium can also be deposited in the tissue, but not always. It's interesting that they actually have found this in young people. It's not just in folks that are more seasoned, if you will. Actually, there was we're going to talk a little bit more about him in a minute. His name is Dr. Kilmer McCulley. He actually discovered in 1968 from a case of a young boy in 1933 at Mass Gen. They actually had saved the archived autopsy report, microscopic slides, and small fragments of the patient's arteriosclerotic plaques that were preserved in paraffin. He was very curious to see what those plaques were formed, what actually was in them. And what he found was there was no cholesterol or fat in those plaques. But this boy definitely had arteriosclerosis, hardening of the arteries. And so what he also found, which was interesting, is that children with certain neurodevelopment challenges have higher levels of homocysteine in their blood. And they found that elevated in their urine as well. And so then actually got him on a journey to look into homocysteine and its role in heart health. And we're going to talk a little bit more about that later on in the presentation. But first, we'll talk about cholesterol, because that's, you know, what most people think of when they think of heart health. They think of cholesterol. It's been a little bit vilified in the last, 60 plus years. But here's the thing. You need cholesterol. You need it for hormone production. It's essential for life in this way. You need it to be able to produce adrenal and sex hormones. You need it for nerve tissue development. You also need it to produce bile. Bile salts are used to emulsify fats and digestion. If you don't have adequate bile in your body, you're not going to be able to digest fats well. And so Dr. Kilmer McCulley, again, he was a Harvard Medical School professor and also a pathologist at Massachusetts General Hospital. He was quoted as saying, "In the past, fats and cholesterol in the diet were blamed for causing heart disease, but years of medical research have proven no convincing evidence that these components of foods actually caused hardening of the arteries. In fact, scientists have proven that pure cholesterol does not cause arteriosclerosis, and that elevation of blood cholesterol is a symptom, not a cause, of heart disease." So where does cholesterol come from? It's a great question. At least 60% of it is made on demand in the liver. They've found up to 20% is made in the intestinal tract, and up to 20% is also made in interstitial tissues. And that cholesterol that we get from our diet actually has a rather negligible amount on the amount of cholesterol that we're going to find in the blood. Now, that's interesting because that really kind of turns everything on its head of what we've been taught up to this point. But your body actually needs cholesterol to do and it will do everything that it can to make it. And it is necessary for life, as we'll talk about a little bit more as we go through. Let's talk about LDL and HDL. So cholesterol is a fat substance. Fats are insoluble in water, and so they can therefore not be transported in blood on its own. So cholesterol has its own Uber service, if you will. LDL and HDL, which those two you're probably familiar with. People think of it LDL as being bad cholesterol and HDL being good cholesterol, but in point of fact, they aren't cholesterol at all. LDL is low density lipoproteins, and HDL is high density lipoproteins. So they're actually proteins, and they what they do is they move cholesterol around in the blood. So low density lipoproteins will drive cholesterol where it needs to go, and high density lipoproteins will actually pick up excess unneeded cholesterol and bring it back to the liver for disposal. Ideally, we want a 2-to-1 ratio. So you should have twice as much LDL as HDL. And so that's actually a pretty good marker to see if they're, overall health, that you have a certain amount of cholesterol, but you want to have that particular ratio in 2-to-1. Sometimes, people will see it's 4-to-1. That would indicate that there's a little bit of an issue. And again, those things can all be addressed from lifestyle and natural health approach as well. So what does cholesterol and heart disease studies have to say? Well, there's quite a bit out there. The most recent one, which I think was very telling, was actually published in the BMJ Open Journal in February of 2016. And it found that 92% of people with high cholesterol level actually lived longer. The review of research actually involved nearly 70,000 people and found there was no link between what was traditionally considered bad cholesterol and the premature deaths of over 6-year-olds from cardiovascular disease. So, and that was very recent, published recently. So, and it's a large study. So it wasn't just a small study. This was nearly 70,000 people that it observed. So I think that that's telling us that where we've been headed with this idea that cholesterol is the demon in this issue, it isn't. And there's other factors at play, which we're going to talk about a little bit more as we go. Now, if you're interested in more studies, we do have a couple links here. On Mercola's site, he actually, this particular article in 2019, which was called Cholesterol Myth, What Really Causes Heart Disease, that actually had a lot of references to different studies that show that cholesterol really isn't the real bad guy in this situation. There's other things involved. But then also you have to keep in mind, as I mentioned, you need cholesterol for a lot of things to support life. So if you have too low of cholesterol, that can actually cause a lot of problems as well. If you want to get more information about cholesterol and what the different levels actually mean, there's actually an infographic, which is on the next slide, that Mercola put out, which I think is very helpful. And you can learn more about the benefits of cholesterol and why you actually don't want your levels to be too low in this particular article that he published out in 2013, which was called Cholesterol Regulates Cell Signaling. And if anybody wants links to these articles, please let us know. Drop us a note in the comments. We can certainly get those out to you. But this is the infographic that I was mentioning. It's on Mercola's site at this particular address. And he talks a little bit on here about how to make sense of your cholesterol levels, what are the types of cholesterol, and a little bit more about like what type of levels you should be looking at from a holistic health perspective. So if you want more information on that, please feel free to jot down that address and go out and check that out. I think that's very helpful for people. So let's just talk real quick, briefly about fats in general. So natural fats are going to be really one of three. You're going to have saturated fats, which the rule of thumb with those is they're solid at room temperature. They actually are needed for cholesterol production in the body. But then we also have polyunsaturated and monounsaturated fats. Those are liquid at room temperature. And I know that another thing that we've been taught is saturated fats are bad and poly and monounsaturated fats are good. But that is not, I don't believe that to be true. I believe that we need to have a variety of different fats coming from natural sources, including saturated fats. It was interesting in this article in the Lancet, they actually saw that even when deaths from heart disease fell, overall morbidity rates did not fall. as deaths from heart disease fell, cancer actually increased. And so this study was actually an incidence of cancer in men that were on high polyunsaturated fat diets. So I think in the end, um, it's all about balance. You don't want to have too much of one and not enough of the other, and you want to get them from whole food, healthy um, whole foods. Now, one fat that you need to absolutely stay away from at all costs is trans fats. So most people do know that now, which is excellent. Those are man-made oils. So anything on the label that says hydrogenated or partially hydrogenated oils, you need to run from them. Just put that back on the shelf and find something else. Those are very bad for your body. And this study, as quoted, that they saw that where margarine and solid vegetable shortenings were used in significant quantities, rates of heart attack was always higher than when they weren't. And luckily nowadays, I think most people do know that, but keep in mind, anytime you need to look at labels. If it says hydrogenated or partially hydrogenated oils, those are trans fats, and you need to put that product back on the shelf. Go and find something different that's more of a whole food, healthy oil or fat. So let's talk a little bit about fats and oxidation. So oxidation occurs when a food, or really anything that is come in contact with heat, air, and light. So Rudolph Ballantine, which is a medical doctor, had said, been quoted as saying, once the oil is removed from the plant material, so these are plant oils, it seems to become susceptible to a whole host of destructive influences. And so this is unfortunate because most of us are not pressing our own oils. So most of the oils that we get are actually have been pressed for us and packaged. And so, we're going to talk about some of the things that you can look for in oils to try to minimize some of these destructive influences on oils. But it's interesting, there's been a lot of studies, these are just two, but heating fats actually does change the structure of the fat molecule, which will lead to it being rancid. Now, a rancid fat, interestingly enough, will not smell or taste any differently. So, but it will be full of free radicals, which we don't really want in our body. So these are just two studies that I had read about. One was a rabbit study. And in this case, they gave the rabbits an average amount of cholesterol but high levels of heated polyunsaturated oil. And in all cases, they saw increased in arteriosclerosis in these particular rabbits. Now, they also did a monkey study. They were given commercial peanut oil, which is also processed at high temps. And they also saw more arteriosclerosis than the group that they gave just butter to. So there is definitely a correlation between how the fats are processed and the overall health of the fat. So it's not just that it's saturated or poly or monounsaturated, it's also how it's been processed. One kind of interesting note I read about, maybe some of you are familiar with the Hunzas. I think National Geographic did a study on them, I don't know, maybe 40 years ago or something. But they at one point in time were actually very separated from Western influences, and they had just a very natural lifestyle and diet, and they lived in the Himalayas. They still do, but they've actually, from what I understand, become a little bit more westernized, and so some of their health has actually depleted. But at the time, they lived well into their hundreds, and they were very, very healthy and vital into that old age. And so one of the things that they actually did was that they would prepare apricot pit oil, and it would last 1 to 2 days, and then it was done. They always were eating oils that were from natural oils that were fresh pressed, and they never had anything that they ate that was over 1 to 2 days old in regards to those oils. So that was just another thing that they did that was helpful to their overall health. So if you're looking for mono and polyunsaturated fats, which are very susceptible to oxidation, the things you want to make sure is, one, that they are cold pressed, and two, they should be in a dark glass with a tight lid, and you should refrigerate them. So you really actually don't want them to be exposed to light, air, and heat. Now, one note, saturated fats such as organic coconut oil and butter, those are actually very difficult to oxidize. So those don't necessarily have to follow the same guidelines, but poly and monounsaturated fats, you really have to be very careful in the quality that you're getting, and that they're cold pressed, dark glass, tight lid, and that you keep them refrigerated. This is interesting. Oxy-Cholesterol. I've never really seen a lot of this talked about. Maybe some of you are familiar with it, but this is actually cholesterol that actually that contains an extra oxygen atom. It's very harmful to arteries. Now, how this is made, it is created when cholesterol is heated at high temperatures. So you're starting to see a little bit of a pattern here. When you heat oils too high, it causes problems. But some of the things that have this type of cholesterol are things that are like fried foods. So because they're being heated to such high temperatures, so fried food is one of them. And also powdered egg and dairy products, which, you know, you're like, well, I never eat that. But the problem is that it's in most packaged foods. That's what they use to, you know, in commercial, you know, baked goods. And so, but powdered egg and dairy products, how they're prepared is a spray drying process. And so they are exposed to high levels of heat, air, and light. And it adds this extra oxygen atom to the cholesterol in that particular fat. And it's very damaging to the arteries. But it is in most prepared baked goods. And so that's things like crackers, cookies, and other packaged products. And so just keep that in mind. Those really aren't healthy for us, even if it has, you know, it looks like it's, you know, healthy with leaves and things on the package. We really actually do need to start cooking, baking things at home using whole foods that are actual foods that haven't been heated in this and changed in this way. One thing I would say that is good in the last 4 months of dealing with all the things we've dealt with this year is we have more time. And I would highly recommend that people get back in the kitchen and cook for yourself. It's a skill I think that we've lost because we've been so busy running, and that's the one thing I think that actually has a good thing, is that we can start slowing down a little bit and start cooking at home with real food and not just buying it in a package or a box or a can. Also, just want to note on eggs. They were kind of vilified too. I think that they've been redeemed some in the last 10 years, but because they have a lot of cholesterol in them. But what they also have is a lot of lecithin. Lecithin is a substance that will emulsify cholesterol, and it is also needed for proper brain function. So eggs, if you can eat them and they don't cause you any digestion disruption, they're very good for you, and they're very good for your brain. So in nature, it was packaged in such a way as it's not just has cholesterol in it. It has the other compound in it that emulsifies the cholesterol, which is lecithin. So eggs are very good for you, and I definitely encourage you to eat them from time to time. So animal fat, I get this question a lot. I actually think animal protein in general is helpful to the body in moderate amounts. But there's definitely a question of quality over quantity. So when you consider commercial beef and chicken farms, one, they are very overcrowded. Like if you ever watch documentaries on them, you will just be aghast at the living conditions of these animals. They're very unsanitary. They are fed on an unnatural diet. We'll talk about that in a second. They are usually kind of unhealthy. So there is the use of antibiotics, at least with beef, and there is pressure to increase production. So there is the use of hormones, especially with beef. So talking about beef specifically, they've done studies on this where the omega-6 to omega-3 ratio in beef in a grass-fed cow is 3 to 1 or 4 to 1. which is about how the ratio that we need for omega-6 to omega-3. Omega-6, those are more fats for that are used more for pro-inflammatory processes, which we actually do need. Those are not bad. We do need those. But we also need omega-3s, and they are more used for anti-inflammatory pathways. The problem is we get lots of omega-6 in our diet. We don't get enough omega-3. And in this case, a grass-fed cow is about 3 or 4 to 1, omega-6 to omega-3. But a grain-fed cow meat is more 18 to 1, so 18 times the omega-6 to omega-3. And so you can see that even though maybe it doesn't taste very different, the overall composition of the meat is different. And, you know, I also want to point out mammals store toxins in fat and other tissues. And so, and we know this is true. So if you have animals that are very unhealthy and they have a toxic buildup in their body, it's going to be stored in their fat and their other tissues. So it's really important that if you do have animal protein in your diet, that you choose the animal protein that is organic and has natural diet, a natural, you know, that they're pastured and they have a natural diet. And in the case of like a cow, that's grass. That's not grain. You don't want a grain-fed cow. You want a grass-fed cow. And if you can find it organic, more the better. So that's kind of where I stand on animal protein. I think it's very important, but I think you need to spend a little bit more on quality and maybe eat a little bit less. So it's going to be about the same price. You're just going to eat a little less of it, but it's going to be higher quality for your family. So I mentioned homocysteine a little bit earlier, and this is, I think, one of the most important things to look for in a blood panel if you're interested in supporting heart health. Homocysteine is an amino acid that is found in the body. It's actually not normally present in small amounts, and it's a byproduct of our metabolism. The problem is too much of it actually can cause arterial damage. It actually is carried around through the body on LDL molecules. And it's interestingly enough, your body can actually convert homocysteine with the use of B6, B12, and folic acid into methionine. Methionine is an essential amino acid, and it is completely benign and harmless to the heart. But unfortunately, 66% of Americans have been found to be deficient in all 3 of those B vitamins. So, and that's based actually in the Framingham Heart Study, which is a very well-respected heart study, very large. So that's a big issue. So if you don't have enough of those B vitamins, you're going to have a hard time in conversion of homocysteine to methionine. So what increases homocysteine in the body? Processed foods, drugs, lack of exercise, diabetes, and high blood pressure are absolutely factors for increase of homocysteine. And if you do pull this on a blood report, low risk is if it's in between 6 to 8 micromoles per liter. High risk is if it's over 12. So if you pull that with your primary care physician, those are the levels you're looking for. And I will just a really quick point out that methylfolate. So one thing that is needed for conversion of homocysteine is methylfolate. So it's folate that has been methylated. There is another consideration with what's called the MTHFR gene mutation, and there's about they estimate about 40% of people have this gene mutation to some degree, and it causes you to not be able to methylate well. And if that's the case, then the person has a hard time creating methylfolate, and that will also inhibit your body's ability to convert homocysteine into methionine. So those are things that all can be supported naturally as well, by the way. There are certain herbs that actually can help support your liver in this process. And so definitely let us know if this is something of concern or just interest to you. So exercise and heart health. Well, basically, plainly, exercise makes muscles work harder. It increases demand on your respiratory and circulatory systems. It creates blood volume to be pumped through the heart and veins. And the heart doesn't have to beat as fast because more blood is released per contraction. So muscles become hungry for the blood fat for fuel, and you will reduce triglycerides in the blood. It also will increase HDL production, which is that Uber surface that goes and removes fatty deposits from arterial walls. It also has the effect of decreasing homocysteine. So absolutely 100% we need to exercise. And you know what, folks, we do have more time now, right? In the last 4 months, we need to get on an exercise program and, you know, at least 3 times a week, get your blood pumping. It really is good for you. Even honestly, if you just go out and walk 3 times a week, it's going to do amazing things for you. Now, Dr. Abe, who's the associate professor at the AAB Cardiovascular Research Center, the University of Rochester Medical Center, has been quoted as saying, "The force created by fast, steady blood flow as it drags along blood vessel walls has been shown in recent studies to protect arteries from atherosclerosis." So you just think of that blood flowing through there. It helps with that as well. So definitely get out and start moving. Now, blood sugar and heart disease, this is, I think, honestly, I think at the root of a lot of the problems we see. High blood sugar has 2 effects on cell lining blood vessels as part of atherosclerosis. One, the production of free radicals, highly reactive molecules that cause premature cell death, and reduces the availability of a nitric acid, which relaxes blood vessels and increases blood flow. That same doctor that I just quoted has also been quoted as saying inflammation in blood vessels is one of the main drivers of atherosclerosis, and diabetes makes it much worse. A key signaling enzyme both protects the heart in normal cases and is sabotaged by the chemicals produced in diabetes. And so it's important that we understand that blood sugar problems actually does cause inflammation in the arteries. And refined carbohydrates are just as bad as sugar. So I've had a lot of people say, yeah, but I don't eat sugar, but they eat a lot of refined carbohydrates. That includes white flour, white starch, white rice, starch, and sugar. These are actually rapidly converted into glucose in the blood, and that increases insulin for glucose cellular metabolism. But too much of this will lead to insulin resistance. And so if you have chronic elevated insulin, it leads to inflammation of the arterial walls. It's actually toxic to those arterial walls. And diabetes increases atherosclerosis related inflammation, which doubles the chances of a heart attack. And it's not just folks that have diabetes, it's anyone that has issues with glucose management where they're having blood glucose elevation because they're insulin resistant. We'll talk a little bit about statins. I'm not a big fan. If it were me, I would never take a statin. I think that they are horrible almost in every way, and they're very bad for the liver. As we've kind of mentioned, from what I have seen, that cholesterol is not the biggest demon in this whole situation. It truly is not. And I think blood sugar has a much bigger role to play. And so statins, just artificially reducing, cholesterol in your body, I don't think that that's getting to the heart of the problem. I think it's just treating a symptom of the problem. Statins will decrease production of CoQ10, which are obtained in meat and nuts, which weaken the heart muscle, which a lot of people do know. Dr. Kilmer-McCulley had been quoted as saying, while the deaths from heart disease and heart attack have declined, the incidence of death of heart failure have increased in the past 15 years. And that was in 2000. That's actually gotten worse since then. But again, statins actually put a lot of stress on the liver, cause toxicity of the liver. They have gastrointestinal side effects such as bloating and diarrhea, muscle weakness and damage. They're proven to cause cancer in some laboratory animals. Experts really have, when they first came out, only recommended them in individuals that were considered to have a short life expectancy. And Dr. Kilmer-McCulley actually only recommended them with people with cholesterol levels over 300 and a reduced life expectancy due to heart disease, because they were so bad in other ways with their other symptoms and side effects. So I would really, if I were you, I would do a lot of research on the symptoms and side effects of statins and weigh that against the benefits, because there's a lot that you can do to lower your cholesterol in lifestyle and nutrition. Yeah, it might mean you'd have to change a few things about your diet and how you move and how you know get out there and exercise. There's things you might have to do, but I'm telling you, those are much better in the long run than this particular option. So this is actually a real person. And this is, you know, I'm sharing this in that she shared this, and this was, she did a lipid panel before and after doing the Standard Processes Purification program. And so what this, I think that the why this is telling is that really in the Standard Process Purification program, the biggest thing that's being removed in that 3-week period of time is sugar and starch. So there's still fat in there. It's going to be whole food. They've taken out processed foods, and you're taking a shake that helps support liver and liver detoxification. And so before she did it, her cholesterol was 344. Triglycerides were a whopping 787. That's crazy. Heart risk was 7.2. And 3 weeks later, on May 7th, cholesterol was 180, triglycerides 108, and heart risk was 3.7. And so what I'm saying is, she was having some fat in this. It's not like a fat-free type of a situation, but there is no sugar and there's very little starch. And so that's that. I think that is the big thing here, and no processed foods. So there's no question that these blood factors can absolutely be changed with diet, but it's not necessarily what you think. It's not like a fat-free diet. It has more to do with getting rid of sugars and starches and processed foods. So if you're looking for some resources, these are 2 books I would recommend. I talked about Dr. Kilmer McCulley, and that's his book. I would highly recommend that you get and read that. It's called The Heart Revolution. And then also this other, because I talked about blood sugar and that I really do think that plays a huge role in heart health. This is Dr. Mark Hyman. He's a medical doctor. He's the head of functional medicine at the Cleveland Clinic. And this book was, I thought, a really good book, and it had a lot of really practical tips on how to support having a really healthy diet and regulating blood sugar. And so if you guys have any questions whatsoever, please don't hesitate to drop a note in the comments or give us a call. Any of the links that we had put out, we'd be happy to share them and answer any of the questions that you have. And if you're a patient of ours, I look forward to seeing you in the office. I know Dr. J looks forward to seeing you as well. And also, we will be meeting a week from this Saturday, which I believe is August 8th. And we're going to be doing a community lunch and learn where you can bring your own packed lunch and a chair, and we'll have a socially distanced sort of Q&A where you guys can bring questions that you have about the presentation or any other question that you might have about health. Dr. J and I will both be there, and we can all have our packed lunches, and I'll talk about just a couple brief points about this lecture and answer any of your questions that you have, and we can have a little community together of people that are very like-minded in regards to wellness. So anyway, I hope you guys have a great night, and talk to you soon.